When I compare my master's statement of purpose that got me into Harvard, Yale, Columbia, to my PhD statement that won me close to $500,000 in scholarships in the best institutions in the US and Canada, I see stellar differences. So in this video, I'm going to read my PhD statement of purpose that got me into the best institutions in the US and Canada. So let's go. My name is Dr. Vanda Khalifa. I'm a physician and a PhD student at the #1 School of Public Health, the Johns Hopkins Bloomberg School of Public Health. I was also a recipient of the prestigious MPH MBA SOMA Scholars Program here at the Bloomberg School. On this channel, we talk about strategies to help you break through your academic and personal developmental barriers. So if you're new to this channel, kindly subscribe, like, and share to your friends so that they can also benefit. Let's dive straight into my statement of purpose. One feature that distinguishes your PhD SOP from your master's is that for a PhD, you emphasize a little bit on your relevant research experience and more especially your aspirations for a selected field or interest and what you anticipate to do in future that would advance the field that you are applying into. So let's dive straight into my introduction for my PhD. Let's go. So this is how the intro to my PhD statement of purpose reads. The current pandemic has revealed the ominous threat posed by emerging infectious diseases to human civilization. COVID-19 has affected every individual and community worldwide, and the effects are even more devastating in underserved populations. I'm currently the manager for COVID-19 case investigations program within the Baltimore City Health Department. I am responsible for planning, conducting case investigations, and providing direction to program supervisors and contact tracers. The ravaging effects of the ongoing COVID-19 pandemic underscores the need for future epidemiologists. So as you can see, the introduction to my statement of purpose was not unnecessarily long. It was short, gave a summary of what I will likely talk about in the body of the statement of purpose, and also laid out the reason that I think I need to do a PhD in a field of my interest. So once these are clear, you move to the body. So let's go to the body of the statement of purpose. Let's dive into the body of the statement of purpose that I use for my PhD applications. I never envisioned becoming a physician. It certainly was not easy, but my resolve helped overcome multiple barriers and rise above my family's socioeconomic background. Ultimately, I became a physician to serve communities similar to mine. However, it became immediately evident as a clinician that effective population-level interventions would be the best strategy for improving lives in the settings I worked. The vulnerabilities in the current public health system in West Africa became profoundly clear after volunteering with the United Nations from 2015 to 2017. As a clinician, part of my role was to assist in Côte d'Ivoire's response to the Ebola virus's ravaging effect. Though Africa has not been seriously impacted by the ongoing COVID-19 pandemic so far, existing and emerging infections could have a devastating impact on the continent amid the relatively weak public health infrastructure. Public health enthusiasts like me must acquire in-depth knowledge of epidemiology to enact an effective regional response. The exposure I had working with the UN in multiple countries bolstered my interest in becoming a public health leader, researcher, and advocate. Next paragraph. My desire to become a leading independent investigator is why I enrolled in the prestigious SOMA Scholars Program at the Johns Hopkins Bloomberg School of Public Health. My experience as a SOMA scholar was transformational. I spent 2 years intentionally building strong foundational skills in epidemiological methods and biostatistics needed to conduct research. While the MPH deepened my knowledge in epidemiology and biostatistics, the MBA taught me vital competencies in teamwork, systems thinking, and leadership, all while improving my interpersonal and communication skills. My commitment to the MPH MBA program earned me a membership in Beta Gamma Sigma upon graduation. So let's break this down. So these first two paragraphs really talks about what you have done over the past couple of years to make you fit for the program that you are applying. The foundations that you've built so far, what separates you from the rest of the applicants, right? Unique experiences you've had that is motivating your sudden interest in advanced program or advanced degree in whatever field you're applying. So and you can see that in the second paragraph, I needed to establish the reason why I needed an advanced degree in epidemiology, even though I had an MBA, right? Because some program directors may think that, oh, you're just accumulating degrees. So it's very important for you to clarify anything that you think might be ambiguous. So the MBA, though it's not directly related to research work or it's not directly related to epidemiology, it's essentially establishing the fact that it's giving me some unique skills that would be very essential as a doctoral student. So in the next paragraph, while developing classroom-based knowledge, I simultaneously worked on multiple research projects as a research assistant, including research exploring stigma, mental health, and other correlates of HIV, STI tests among vulnerable populations in the Gambia. A resulting manuscript is in the final stages for submission in the Journal of Acquired Immune Deficiency Syndrome. I also won a scholarship to attend an international AIDS conference in 2020. While working as a graduate intern with Japago in Lesotho, I helped develop a custom model for Lesotho's Ministry of Health in their government 5-year strategic plan to combat HIV/AIDS. Upon graduating, I collaborated with Dr. Karakusis at the Johns Hopkins Medical Institute, Department of Infectious Diseases, to publish a paper on the predictiveness of the Global Health Security Index rankings and the real-time response of OECD countries to the ongoing COVID-19 pandemic. A second manuscript is in progress to assess statins' effect on COVID-19 recovery for inpatients within the Johns Hopkins Hospital. Additionally, I collaborated with a group of researchers at the Department of Surgery to submit a manuscript exploring bariatric surgery's impact on chronic opioid use. In the next paragraph, it says, though I am actively involved in COVID-19 response at the Baltimore City Health Department, I am also a research assistant in the Department of Epidemiology. I am working with Dr. Barrell and other scientists in conducting systematic reviews on patient-centeredness interventions to improve outcomes of patients living with HIV in low and middle-income countries as part of the Life Implementation Science Project. The review informed a recent WHO Guideline Development Group meeting, resulting in a new best practice. Since graduating in May 2020, I've had 1 publication, 2 submitted manuscripts, with 3 manuscripts in progress. So as you can see from the last 2 paragraphs, what I did here was to try and establish why I think I'm suitable for the PhD in infectious disease epidemiology, The research experience I've enumerated here are all related to infectious diseases, whether COVID-19 or HIV or other sexually transmitted infections or other emerging infections. All of these experiences have been laid out, publications laid out to show that I have had an experience or have, let's say, some research work done in this particular field. So this paragraph is very, very crucial. With my research experiences, MPH, MBA training, and my clinical and life experiences, it has become increasingly clear the incredible value formal study of advanced epidemiology will add to my career objectives. I am confident that seeking doctoral training in epidemiology is the best next step for my career progression and my vision of improving population-level health outcomes through cutting-edge epidemiological research. My interest in doctoral-level training originates from my passion for building a career dedicated to becoming a research scientist who contributes to improving marginalized populations' lives. I aim to pursue a doctoral training in epidemiology focusing on infectious diseases. My research interest will utilize advanced epidemiological methods such as advanced longitudinal data analysis, latent class analysis, mathematical modeling, and multi-level modeling to help unravel transmission dynamics and novel modalities to prevent existing and emerging infectious diseases. The end goal is to use advanced epidemiological methods to develop evidence-based interventions to prevent, control, and reduce the burden of infectious diseases. I am confident that I can positively contribute to the existing research body and help develop innovative infectious disease interventions. So this previous paragraph that I read is very crucial, right? It's very essential in that it's also highlighting the reason why you need an advanced level training in epidemiology. You've done masters in epidemiology, so why do you need the advanced degree? So this establishes that there are certain skills that you can acquire from a doctoral level training based on your career objectives that you didn't get during your masters. So it's very important to highlight that part. And in the last sentence, it states that you are confident you're positively going to contribute to existing research body. So this shows your plans for the discipline or your contributions for the discipline, which is also certainly very crucial. So let's move to my last one paragraph. So my long-term goal is to become an independent researcher and a global health infectious disease expert, addressing infectious diseases' devastating impact, especially in low and middle income countries. I will collaborate closely with research centers across Africa, especially the newly established Center for Infectious Disease Control in Ghana, primarily built to respond to existing and emerging infectious diseases. I will work closely with the center and help make it an internationally recognized research facility. I want to be the catalyst that initiates change needed to improve the research culture among medical and public health professionals in Africa. Being the first ever physician from a community makes my passion for public health and research deeply personal. So this is the last but one paragraph, which clearly talks about your end goal, right? What are your future aspirations? Of course, your future aspirations or objectives may change along the line, but at the point that you're writing your statement of purpose, you need to be clear what you want to use that degree for. Okay, so let's look at the last or the concluding part of my statement of purpose, right? Thus far, the experiences and the quality of training I had during my MBA program leave no doubt in my mind that the Bloomberg School of Public Health's epidemiology program would be the best place to earn my PhD. I was genuinely impressed by the faculty and students' diverse nature and the rich, dynamic educational environment. It would be an absolute honor to work with world-renowned faculties such as Drs. David Dowdy, Chris Berre, Stefan Barrell, and any of the fantastic faculty doing extraordinary work at the department. I am convinced that the school's PhD program would help me acquire and leverage epidemiological and analytical skills to realize my ambitions and future goals. I am highly motivated and enthusiastic to work assiduously to succeed in a doctoral program. I look forward to continuing my academic and professional journey with the Bloomberg School of Public Health. So this is the conclusion of my statement of purpose, and as you can see, it lays down the reasons why you still want to stay at Hopkins, or you still want to get your PhD at Hopkins, right? Why do you want Hopkins? Or if it's any other school, so in my case, why Michigan? Or why University of Toronto? Or why McGill University? So you give all those reasons, and then if you've communicated or you've worked with any faculty member that you think you would benefit from continual learning, you can mention their names. So in this case, I had to introduce some names because I had reached out to them and expressed my interest in becoming a PhD student. So, and I briefly mentioned their name in my statement at the last part, but see how I also left it open that and any of the fantastic faculty doing extraordinary work. So this means that even if the ones you've mentioned their names are not willing to take on doctoral students that particular academic cycle, you are open and versatile enough to work with other faculty members. So this is the end of my PhD personal statement. If you haven't checked my master's personal statement that I used to get admission to Harvard, Yale, Columbia, and Johns Hopkins, you should kindly check it out and then compare the two. If you have enjoyed this video, kindly like, subscribe, and share so that other people can benefit. I'll see you in the next video. Bye-bye.